My name is Dr. Bob Ryder from City Hospital in Birmingham, and I'm reporting here some outcomes with regard to 90 consecutive patients with long-standing poorly controlled type 2 diabetes and obesity treated with EndoBarrier in Birmingham. This is an EndoBarrier, a 60 centimeter impermeable sleeve implanted with an endoscopy procedure into the first part of the small intestine such that the food passes through it rather than the small intestine, and it mimics the bypass bit of the Rouen-Y bariatric procedure. We provided EndoBarrier to 90 patients with type 2 diabetes and obesity suboptimally controlled by standard therapies, and we monitored outcomes in a registry. As many of the serious adverse events associated with EndoBarrier occurred during the last 3 months of treatment, we were interested in comparing the outcomes of 9 months versus 12 months implantations, both for safety and for efficacy. And these are the baseline characteristics of the 78 patients who attended for review, both at 9 months and 12 months after EndoBarrier implantation. And I draw your attention in particular to the fact that they were very obese with a BMI over 40, poorly controlled with a hemoglobin A1C nearly 80. They'd had diabetes for a median of 11 years, and over half were taking insulin. And this compares the impact of EndoBarrier at 9 months and 12 months, and it can be seen that the fall in hemoglobin A1C of 20.5 millimoles per mole was no difference between 9 months and 12 months, whereas the fall in weight was 13.8 kilograms by 9 months and 15.5 kilograms by 12 months, indicating that patients lost an additional 1.6 kilograms in the last 3 months. But of course, we're interested in how many serious adverse events would have been avoided by reducing the implant time to 9 months. By 1 year, 40 of the 90 patients had required an earlier EndoBarrier removal for serious adverse events, 5 for gastrointestinal hemorrhage, 2 for a liver abscess, 1 for another type of intra-abdominal abscess, 1 for cholecystitis, and 5 for gastrointestinal symptoms. All made a full recovery and most experienced benefit despite the complication, but it was noteworthy that 6 of the 14 cases, i.e. 43%, of those serious adverse events would have been avoided by removal of the EndoBarrier at 9 months. This shows a breakdown of the serious adverse events that occurred before and after 9 months, and by all means pause the presentation if you wish to consider this list further. And I highlight in particular the liver abscess and cholecystitis cases that occurred after 9 months. In summary, our data demonstrates that EndoBarrier is highly effective in people with long-standing poorly controlled type 2 diabetes and obesity. Reducing the implantation period from 12 months to 9 months would have resulted in slightly less weight loss, 1.6 kilograms, but no difference in the considerable improvement in hemoglobin A1C. But it's important to note that there would have been a 43% reduction in serious adverse events requiring early removal by taking the EndoBarrier out at 9 months. These data, we believe, support a change in the recommended implantation period for EndoBarrier from 12 months to 9 months. As endoscopy units are ubiquitous, delivery of EndoBarrier treatment would be relatively straightforward. And now I'd like to show you some actual patients. You can see that this patient has achieved all the benefit of EndoBarrier by 9 months with a 23.1 kilogram weight loss and normalization of his hemoglobin A1C. By 9 months, this patient had achieved 17.3 kilograms weight loss, and her marker of fatty liver, the alanine aminotransferase level, had normalized. As well as diabetes, this lady had obstructive sleep apnea, requiring her to wear a continuous positive airway ventilation mask in bed overnight when sleeping, such as the mask illustrated. By 9 months, she's lost 14.1 kilograms. She'd experienced a major reduction in insulin requirement, and she no longer required the CPAP ventilation, as you can imagine, she was very happy about that. This lady lost 12.4 kilograms by 9 months. Her insulin requirement dramatically reduced and her impaired renal function improved. By 9 months, this lady achieved a 25.2 kilogram weight loss, and there was a massive reduction in her insulin requirement. Now let's see the patient who had an early removal because of EndoBarrier obstruction and GI symptoms. By 9 months, she'd lost 20.2 kilograms. She no longer required insulin, and if we'd removed the endobarrier then, she would have avoided 5 days of pain and the difficult removal of an endobarrier that had migrated and was blocked by food. And now let's see the cholecystitis patient. By 9 months, she'd lost 27.8 kilograms. Her hemoglobin A1C had dropped to 47, and if we'd removed the endobarrier then, she would have avoided cholecystitis with vomiting, pain, and the requirement for intravenous antibiotics. Finally, the liver abscess patient. By 9 months, she'd lost 9.4 kilograms. Her hemoglobin A1C had fallen to 51 millimoles per mole. And if we'd removed the endobarrier then, she would have avoided the liver abscess. I thank you for your attention.